Thank you for joining. We will be live shortly. Thank you all for joining us. Please enjoy the event.
Welcome. I'm Julie Cashin, Director of Women's Economic Justice and a Senior Fellow at the Century Foundation. For accessibility purposes, I am a white woman with reddish brown hair. I'm wearing my reading glasses. Unfortunately, I need them. I'm wearing a pink shirt and a black blazer. The Century Foundation is a progressive, independent think tank that conducts research, develops solutions, and drives policy change to make people's lives better. I'm also the mom of a 9-year-old. I want to thank my incredible co-hosts for their support for today's event. They were all listed in the slide you just saw. They're longtime partners in this work of building the care economy that America needs. We are here today to talk about the childcare cliff. In just over 100 days, on September 30th, 2023, childcare for millions of children and families nationwide could begin to disappear, with dire consequences for women, children, families' earnings, and state economies. During today's event, I'm going to share the findings of our new report that projects that 3.2 million children could lose their childcare if Congress doesn't act. And you are going to hear from elected officials, a family childcare provider, a mom, and a pollster about how we got here and why this is such a pressing issue. Before we get started, a few housekeeping notes. Please note this event is being recorded and live streamed. If you'd like to submit a question for myself or for any of the panelists, please use the chat feature. Include your name and organization or outlet when you do so. Now let's get started with some remarks from Senate Child Care champions, Senator Patty Murray from Washington State and Senator Tim Kaine from Virginia.
First, let me just thank the Century Foundation for hosting today's discussion and everyone for joining. Before the pandemic, our nation's childcare system was hanging on by a thread. When the pandemic hit, it was headed straight for collapse, with providers who were forced to close their doors at the very same moment families desperately needed more childcare options. That's why I fought tooth and nail to save the sector from collapse. And that's what Democrats did. We delivered an historic federal investment that has now helped 220,000 childcare providers to keep their doors open and serve nearly 10 million kids nationwide. That is huge. But the funding we provided expires soon. And as this report makes clear, if we don't take action, the consequences for families across the country could be severe. Over 3 million kids could lose their childcare spot as their program closes. And that's the childcare crisis that's been holding so many families back get even worse. And as I've been saying time and again, it's not just families and childcare workers who lose out big in this crisis, it is our entire economy. The childcare industry holds up every other sector of our economy. When we fail to get families the childcare they need, small businesses can't hire the workers they need. Parents, moms in particular, are forced out of the workforce. Everyone suffers. If we don't address the coming childcare cliff, this report shows families could lose $9 billion in earnings each year. We can't afford to let this crisis go from bad to worse. This report is just the latest wake-up call for Congress to take action to address the childcare crisis, and soon. The stabilization funds that we provided to save the childcare sector from collapse show what's possible with serious federal investments. Supporting childcare pays off big time for families and our economy. So let's not wait. I won't stop fighting until we tackle the coming funding cliff and really solve the childcare crisis once and for all.
Hey everybody, Senator Tim Kaine here. It's good to speak to you today about a very impactful report released by the Century Foundation. The report highlights the economic impact of the American Rescue Plan Child Care Stabilization Funds that will expire on September 30. I recently visited with Cheryl Mormon, who's a home child care provider in my hometown of Richmond. Cheryl is not only a child care provider, but has been very active with other child care providers all around the Commonwealth and the country. We spoke at length about how these funds were a lifeline to her and to so many providers who needed to stay open during the pandemic. Providers were able to offer salary increases to their workers, buy needed supplies so that they could continue to offer high-quality child care and keep kids safe during this public health emergency. However, according to the Century Foundation's report, more than 70,000 providers are at risk of closing when these funds run out and the program expires at the end of September. And those closures could cause nearly 3.2 million children to lose their access to child care, impacting not only kids, but also families, and potentially taking many family members out of the workforce who would need to provide this child care on their own. So without funds, the only option for many providers is to raise child care costs for other parents. Families in my home state of Virginia are already paying over $15,000 a year for infant care, and that's 13% of the state median income, and it's higher than housing costs in many parts of my state. Parents, mostly women, are leaving the workforce in record numbers due to the lack of access to quality, affordable care at the very time that my employers are telling me we need to hire more people. The ending of the stabilization funding will only make matters worse. In fact, the report estimates that by the end of the funding, this could cost families an estimated $50 billion a year in lost earnings. In April of this year, I reintroduced the Child Care for Working Families Act with Senator Patty Murray and our colleagues. This Child Care for Working Families Act will continue to support our child care providers through grants that will lower costs, raise staff wages, and ensure that providers continue to provide high-quality care in their communities. The Child Care for Working Families Act will ensure that no working family pays more than 7% of their income from child care, and this will particularly benefit low and moderate income families. Families of extreme low income under our proposal will have free child care. Child care is necessary for children, for parents, and for our workforce, for the American economy, for our competitiveness globally, and that's why I'm proud to co-lead this critical legislation. I want to thank the Century Foundation and all partners for shining a spotlight on this important issue and advocating so strongly for support for high-quality child care in this country. I appreciate all the work that you do.
I'm so grateful. This is Julie Cashin again to Senator Kaine and Senator Murray for their longtime support. If you hear Senator Kaine speak about these issues for a long time, he talks about his son who went into the childcare field. You can see how proud he is, and it's just so heartening. I'm now going to present the findings from the Century Foundation's new report. And to start out, just to say, we are really heartened by the energy and momentum we're seeing this week, sending a message to Congress that with 100 days to go before we hit the childcare cliff, it's time to act now. Because look, just like clean water, safe food, and good public schools, high quality, affordable, and accessible childcare is a national priority that benefits everyone. Families across all income levels share the same interest in providing the best possible foundation for their children, especially in the early years. And 2/3 of children under age 6 have all of their parents either solo or coupled in the workforce. Parents need the freedom to afford childcare and to have the peace of mind that their children are safe and nurtured while they go to work or to school and make the choices that are best for their families. Families throughout the United States need a variety of affordable childcare options that employ qualified and caring early educators who are able to meet children's diverse needs and help them thrive. But this is not the reality for most families who are obstructed at every turn by a scarcity of childcare options that meet their budget or needs. The average annual cost of childcare currently is more than $10,000 per year for one child. In some states, it's as much as $15,000, $20,000 a year. It's more than the price of a mortgage, rent, or public college tuition in most states. And many childcare providers are finding it increasingly difficult to hire or retain passionate staff members who can support themselves in childcare's paltry wages, an average of $13.50 an hour. Before the pandemic unfolded, families across the country were already facing childcare costs that were out of reach and childcare deserts due to the nation's failure to invest in a comprehensive childcare and early learning system. Once the pandemic began, school and childcare closures and the increased costs of continued operations for those programs that were able to remain open further exposed the vulnerabilities of the childcare and early education sector. As the number and variety of childcare options shrank, parents and other caregivers were forced to leave their jobs, cut their work hours, or scramble for other childcare solutions during a time when the pandemic made isolating one's own family the safest option. The American Rescue Plan Act stabilization funds, the largest investment in childcare in American history, helped stem the tide of this sectoral collapse by shoring up 220,000 providers, helping them pay for rent and mortgage, utilities, higher wages, and invest in increased health and safety measures. With federal support, states were able to shore up safe nurturing options for families by raising compensation and benefits for early educators, lowering costs for families, and supporting the operating costs required to temporarily stabilize the supply of childcare. As Bryce Covert wrote in the American Prospect, the money has done precisely what it promised, keeping providers' doors open and children enrolled. But it also did something else. It served as a test run for what it would look like if the federal government decided to make a substantial ongoing investment in childcare and early education. And it proved that such an investment would work. When the federal funds expire in September, this progress toward a better resource childcare sector will be reversed. The long-felt stresses of insufficient supply and unaffordable prices will not only return, but will grow, possibly exponentially. In November of 2021, we had a glimmer of hope. The House of Representatives passed legislation that would have significantly expanded the supply of childcare and early learning options. The stabilization funds were enacted while Congress was moving that legislation, the Build Back Better Act, forward, imagining that the resources to provide affordable, high-quality childcare to the vast majority of families would be in place by the time the stabilization funding ended. Instead, the legislation did not pass the Senate, and as a result, the nation now faces a devastating childcare cliff. Knowing how essential these grants have been for the childcare sector and the families that rely on it, my Century Foundation colleagues, Laura Vallega Gutierrez, Leah Woods, and I partnered with economist Jessica Milley from Research to Impact to project the effects that the childcare funding cliff will have on the United States. Using data from the Administration of Children and Families, as well as survey data from 12,000 providers on the impact of those funds from the National Association for the Education of Young Children, or NAEYC, we found that when the funds expire at the end of September, 3.2 million children could lose their childcare slots as programs close, staffing shortages grow, and tuition costs rise. We estimated that a projected 70,000 programs could close nationwide, affecting millions of parents, many who will leave the workforce, reduce their hours, which will cost families $9 billion each year in lost earnings. And the loss in tax and business revenue could cost states $10.6 billion in economic activity per year. That doesn't include the decrease in the childcare workforce, which has been one of the slowest sectors to recover from the pandemic. They could lose another 232,000 jobs. And in 5 states, Arkansas, Montana, Utah, Virginia, West Virginia, and also Washington, D.C., the number of licensed programs could be cut by half or more. In another 14 states, the supply of licensed programs could be reduced by 1/3. Going over the childcare cliff would be catastrophic. Families in all 50 states will lose or have to pay more for childcare. While impacts will be felt along different timelines in each state and to different degrees, we looked at data for each, and the fact is, no state will be spared. 134,000 childcare slots could be lost in Ohio. Washington State could lose 2,000 childcare programs or more. 2,800 childcare workers in Virginia could lose their jobs, all if Congress doesn't take action now. As childcare programs are forced to raise prices to retain staff, parents will have to either pay more, cut back hours at work, or leave their jobs entirely. Lorna Atkins, who runs Growing Places from her home in Huntington, West Virginia, told the New York Times, there are a lot of people in childcare that are going to close down because of this. It's just a fact. Brooke Skidmore, who owns the Growing Tree in New Glarus, Wisconsin, with her brother, also told the New York Times, we are backed into a corner now because we can't decrease their wages because then we definitely won't have teachers, and we can't increase our rates for parents because parents can't pay more than they are. States can make and have made a significant difference in improving childcare. We just have to look at New Mexico, Vermont, Minnesota, Washington, D.C. But the reality is this is all hands on deck moment. The federal government must contribute in partnership with states and localities, employers, communities, and families to ensure that children and their families have the resources they need to thrive. You know, Congress got close to achieving comprehensive childcare in 1971. Then again, as I mentioned, in 2021. Now, as the largest investment in childcare in American history expires in September, children and families cannot wait another 50 years. Congress must act now with immediate solutions, immediate funding, and sustainable longer-term solutions. The Child Care for Working Families Act that you heard Senators Murray and Kaine talk about, for example, would make childcare and early education affordable so that any parent, no matter where they live or what they look like, would have great care options for their children. Century Foundation's new report underscores the urgent need for immediate funding and long-term comprehensive solutions. The clock is ticking. With 100 days to go, it's time to do right by our children and families and finally put them first. Thank you. And now I'd like to turn to Tina Averett, a family child care provider who we are lucky enough to have with us. Great. Trina is a passionate advocate for family child care. She has nearly 25 years of experience providing nurturing care and education to young children. She's the owner of the Foundation for Creative Life, the Foundation for Creative Life, although I'm sure she's had to deal with lice over the years, in Columbus, Ohio. And she's dedicated herself to creating a supportive and enriching environment for children to thrive. So Trina, I'd love to start by asking you, what inspires you to work in family childcare?
Well, my name is Trina Averett, and I have locks. I'm an African-American woman, and I'm currently wearing gray and black. What inspired me to get into the field? Actually, right after I graduated from college, I had a son who was born who had special needs. So like many of the parents who come to me, I found myself looking for quality childcare. And that's what brought me into the field.
Great. And can you share a little bit about your experience during the pandemic? What did you do to keep going, to keep serving the children and families you were serving?
Well, definitely during the pandemic, it was scary initially, and maybe even now, because we didn't know what it was or what was going on. And our work is such, especially as a home provider, you're in your own world, you know. And here we find out there's this possibly, for the lack of a better word, boogeyman out there that could get us at any time. But we had to keep it together for our families. And that's what we do as family childcare. We not only serve children, but the family. So it was scary. You know, we had to wait and get involved in politics. We had to come outside our program to find out what was happening, what it was that we needed to do.
And so what did you need to do? What kind of action did you take?
Well, we needed to pray first and foremost. But beyond that, we needed to wait for guidance. We needed to find out if we would be closed. For a while, I don't know how we were closed. I think for about 2 to 3 weeks we were closed, and we actually had to get a pandemic licensure to operate. We also didn't know at first initially if we would be able to operate. And of course, we answered the call. We were ready. Our families were ready. Many of our families were first responders as well. And so we were there for them. We wanted to be there for them. We wanted to do what we do best, which is serve our families and our children.
That's such important work. Can you share a little, how much money did you get from the stabilization grants and what did you use that money for?
I have received a little under $36,000, and we received our money in phases of 3 particular phases. And primarily because I have had employees, I spent most of my money on employees, on rising costs. I mean, during this time, for a pack of gloves that we use for universal, to change diapers, to pick up soil things, they went from $9.66 to now $46.
Wow.
For a box of gloves from Sam's Club. So prices rose quite a bit. So it was just to do exactly what the money was for. It actually literally helped so that we could continue our business.
Wow. So yeah, so you helped to
Rent,
pay for the salaries, for rent,
mortgage, yes, yeah.
all of it.
Mhm.
And you had shared that at some point you actually had an employee who left for a better paying job. Can you talk a little bit about what happened and
Yeah,
what barriers there are for you to be able to pay more to keep employees?
absolutely, yes. So I did. I had an employee who I had gone through the process. For those who may not know, this is a highly skilled job. People might not think that, but it's a highly skilled job, and quality is very, very important. And you have to take a lot of trainings. So my worker that I had with me, she unfortunately had to leave me because I could not afford to pay her what other jobs were offering. And so that was extremely hard. She was great working here, and she had gone through the process to meet the quality, because my program is a 5-star quality rated program. So, I needed her to kind of, make the whole situation work. So, but yes, I lost her due to, I think she took a job with a health company who could pay her with benefits and dollars that I just don't have. It's not set up for us like that, unfortunately. As the speaker before I spoke, we just don't have. We're not set up that way. Like I'm primarily, my families are publicly funded childcare in my program. I might have a couple of private pay, but the way we get paid off of a reimbursement rate, and so that caps our earning potential. and the numbers as well. In the state of Ohio, was considered a type B provider. So we can only have 6 children at one time. So me even having an assistant was a stretch.
Wow. Well, that sounds like a lot on you then.
Oh, absolutely. Yeah.
Sure. What do you think will happen, or what has happened as the money has gone away or is going away? What does that look like for you? What does it look like for other family childcare providers you talk to or work with?
Absolutely.
What do you think is going to happen?
I'm very concerned. I'm very, very concerned about my fellow educators. Like I said, this is a highly skilled job, and experience matters. So you have a number of folks who are considering retirement. You have people who have gone into debt, taking out second mortgages. So they're up in limbo as to what to do. You have people getting jobs that's not in the care field. This is a highly skilled job where we need folks that care about children, understand children, and understand what they need. So you have a lot of people looking to, not because they want to, but because they're going to be forced to find a way so that they can live. For myself, I've picked up a lot of advocacy work. I've dedicated my whole adult life to my program. And so I have some skill sets that I've acquired that I can lend possibly in other arenas. But I love what I do at home. I love the service that I provide for my families. So we really need legislators, parents, other stakeholders to advocate for adequate funding so that we can care for those who will care for us.
Thank you so much, Trina, for all of the work you do, caring for children, all of your advocacy work. It shouldn't have to be so hard to do the work of loving and caring for children and nurturing young minds. And hopefully, we can collectively work to make that better. Thank you so much.
Thank you for having me.
Now I'm going to move to Diana Lamanji. Diana is a campaign director for early learning at Moms Rising, where she leads a national virtual leadership program and focuses on parent engagement and childcare advocacy. She's also the host of an amazing podcast, Parenting and Politics, where she looks at parenting through a political lens. Check it out. And I'm going to turn to Diana to just tell you, for accessibility purposes, about herself and then ask some questions.
Hi, everyone. Good afternoon. I am here in my home. I have a blurred background. I have light olive skin, long brown hair, brownish hair, and brown eyes. I'm wearing a black Moms Rising t-shirt, which you can't see. And I'm very excited to be here with you all today.
Thank you so much. I wanted to start asking, as the mom of 2 young kids in New York City, what has your childcare experience been?
So like many working parents, when I had my first child at 12 years ago now, I realized that infant care would have cost my entire paycheck. And if I hadn't had the support of my mother, who stepped in to take care of my son full time, I don't know if I would have been able to keep working full time. And my mother was really great. She helped us out a lot. When my son was about 8 or 9 months, she actually fainted. I think partly, she's older lady, long days. So she had to scale back. So we got part-time babysitters, but I remember that was at a time when there was no remote work. So I really had to commute to the office. And I remember looking 5 o'clock and, rushing out to make sure that I was home in time for the sitters to leave. And with my daughter, who's now 6, I was lucky because I was able to spend a little bit more time with her in her first year because we had paid leave in New York State. And at that point, my spouse was freelancing. So he scaled back in order to make the childcare work. And then we did that for both of our kids until they were 2. And then the rate, you're able to kind of lower the costs of childcare. But it was still a good chunk of our take-home pay. And that happened until 2020. And then you know what happened, the terrible, ugly.
Let's talk about that. What happened to your childcare situation during the pandemic?
So during the pandemic, our center closed. They sent us an email and they said we were closing for, about 2 weeks. The last day was, I remember, March 13th, 2020. And of course, no one knew what was happening. So everyone kind of thought 2 weeks, we'll be back. And then March passed, April passed, May passed. And then we got an email saying that our center was going to close. The landlord couldn't keep doing whatever arrangement they had. She couldn't pay to keep the space. So she decided to close her doors. And they told us to pick up our things in June. It was really heartbreaking. I cried. I cried for many months telling the story. And the funny thing is, though, that I thought that my childcare center was safe because we had a UPK program, which is funded by the New York City. So I just was like, we have a UPK, it'll be okay. But it wasn't. So yeah, it was really, really hard. It was completely unexpected. And yeah.
And I'd imagine hard. It's not just hard for you as the parent who needs the care to be able to work, but also for your child to have that disruption in her life, right? To kind of have this consistency, and in this moment of a pandemic wherein things were so challenging in general, to then have this steady kind of loving adults that she was used to not be there anymore.
Yes. So now she had two frantic adults trying to, we worked our schedule so that we would tag team, but that didn't work for a long time. Yeah.
I can relate to that. When did you find new childcare? What changed?
So when the pandemic happened, I was already freelancing. So I, had a little bit of flexibility, but that also meant that I had to scale back because I couldn't work full time or pick up more projects. So I picked up less projects. And then I kind of held out until I felt like I couldn't anymore. I was offered a big project and I decided to take it. And then I had to find a new space, which was really hard to do in normal times. It's really hard to find a center because you have to visit it. You have to make sure that the cost is okay. You have to make sure that it's in a good distance, right? You don't want it to be so far. You have to feel good about the place where you're taking your children to. And in normal times, we would tour those places and get a sense of the teachers and the, community. And that was all gone during the pandemic. So I really relied on my mom community. And I found a center that, hit kind of it was affordable, it was in walking distance, and it had a great reputation, and I was lucky. But it was really a hard transition. Also for my daughter, then you have to take them into a new space and allow them to get used to it. And it took her a long time to get used to the new, and we couldn't go in, so we had to just drop them off and leave. It was really hard. Yeah.
Let's see where you're leaving your child. That's really hard. Well, I wanted to share, our data projects that over 250,000 children could lose childcare slots in New York State because of this cliff. New York parents could lose $846 million in earnings a year, and more than 19,000 childcare jobs are at risk. So I wanted to just ask, having the experience you have, talking to other moms, what are you hearing? How will this impact people? What do you think this means for families in New York and really around the country?
So before I go into what I'm hearing from moms and what I've experienced, I just really want to reiterate that this isn't an individual failure, right? That it really is the systems in place that are failing our families and are failing our kids and our communities and our providers. I loved everything that Trina said. And I, as a mom, my providers were some of the most important people in my children's life and in my life. So the pandemic highlighted, what families are experiencing. We're still in a crisis. Parents are turning down work, which I just shared in my own experience, which of course means less take-home pay. Some parents, it's really, really hard. It's really, really hard for them. I will share one mom from Tacoma, Washington, shared that the lack of affordable childcare was the number one barrier to her ability to work. And she loved her job, but she just couldn't. And she was lucky to find that part-time job. For many moms, what happens is, and I say mostly moms, right? Because the truth is it's mostly moms that have to step back. For Emily, she was lucky because she had the ability to move to part-time, but not all parents have that option, right? So that's one of the things that we're hearing. There's also a mental load. Parents are trying to make it work. You're tag teaming. That is a big, big mental load for parents, which I think is something we don't really talk a lot about. But as parents, we care a lot about affordability. We care a lot about access and quality, and we also care about the people taking care of our kids. We care about them being able to take care of their own families. And right now, many of them are making poverty wages. In New York City specifically, I can tell you our own center lost quality early educators because our small childcare centers couldn't compete with the bigger Department of Education system. So there is a big issue, and people are leaving the field. Educators are leaving the fields, which is another huge issue. But consistently, families want affordability, they want quality, and they want the other side that providers are able to take care of their own families. And they also want childcare that meets their needs, right? So for me, it was really important. We speak Spanish at home. We speak French at home, but it was really important to have that cultural aspect. It was really important to have the language aspect.
Yeah.
Non-standard hours are really important. Something else that is, I think, really important to highlight in my experience also is we think that it ends when kids start kindergarten, but it doesn't, because kids leave school at 2. What do you do when you work a 9 to 5 or non-traditional hours? So that is something also that moms really, really struggle with. It's not over when your child starts kindergarten. And there's also a cost to aftercare, and it's something that can be destabilizing to families, that extra cost.
And of course, not to mention summer, which we're entering, where we have not solved for either. And
in New York City, summer starts in January when you have to find a slot for summer care.
Yes, as it does. Diana, thank you so much for sharing your experience and what you're hearing through Moms Rising from other moms. I know, you talked about how a lot of folks are making the choices or being forced to make the choice to cut back on work, and that doesn't have consequences for only today. It's also for tomorrow, right? That means less earnings over a lifetime. That means less, ability to save for retirement. So these are things that are happening right now, but they have impacts that are really long lasting. So it's so important to think about all of the different pieces of this. So thank you so much for sharing. I'm going to turn to, we're hoping we could turn to Representative Jennifer McClellan. And I will just tell you that she is a mom representing Virginia's 4th district. And unfortunately, she is on the House floor voting right now, which we cannot, fault her with. That is quite reasonable. But we are lucky to have in her place Janie Kamara. Janie is a native of Charlottesville, Virginia, and serves as a legislative aide for the Congresswoman covering education and childcare policy. And Janie, please describe yourself for accessibility purposes, and then we'd love to hear from you.
Absolutely. Good afternoon, everyone. My name is Janie Kamara. I'm an African-American woman with coily black hair and a bun, a black and white blazer, and a black top. Like Julie said, I'm the Congresswoman's legislative aide and legislative correspondent. The Congresswoman sends regards for being unable to attend today's discussion on the state of childcare in our nation. And Congresswoman McClellan is deeply passionate and motivated to make childcare affordable and accessible to every American. Many of you know that Congresswoman McClellan is the first Black woman to represent Virginia in Congress, but what you may not know is that she made history even earlier in her political life back in 2010 as the first member of the Virginia House of Delegates to be pregnant and give birth while in office. In Congress, she's also a part of a very small club as one of 37 moms and 16 moms of color with minor kids in the 118th Congress. So she is keenly aware of the various challenges working parents face and has been a leader on childcare and early childhood education issues for nearly 2 decades. While in the Virginia State Senate, she championed the passage of the Child Care Stabilization and Quality Care Act to invest in childcare and early childhood education providers. And now in Congress, she's a proud member of the bipartisan Congressional Child Care and Pre-K Caucus and a co-sponsor of several bills to improve our nation's childcare systems, including the Child Care for Working Families Act, the After Hours Child Care Act, and the Building Housing with Care Act. As a leader in the Virginia General Assembly and advocating for stronger child care policies, she plans to carry on her efforts here in Congress. She applauds the Century Foundation on publishing this crucial report detailing the childcare stabilization cliff we face in the nation, and she remains committed to helping solve this crisis. Again, Congresswoman McClellan regrets for being unable to attend today and thanks all of you for your continuous efforts to foster opportunity, reduce inequality, and promote security and stability for the American people. Thank you all again for allowing me to take a moment of your time on behalf of the Congresswoman, and I hope you all have a constructive rest of your program.
Janie, thank you so much. And please thank the Congresswoman for us. We really appreciate your and her support. It makes such a difference to have people with lived experience of the childcare challenges in Congress representing us. And we just really appreciate her being there. And with that, I'd like to turn to, I think we're hearing from, we've heard from a provider, we've heard from a parent, we've heard about the data. And now I want to bring in kind of what is public opinion about this? What do people really think Congress should be doing about this? What do people think should be happening? Diana made it really clear, this is not an individual failure. This is something that impacts all of us and has really widespread and wide-standing impacts. And so to talk a little bit more about that, I'd like to turn to Joshua Ferno, Senior Research Manager at Morning Consults. Josh, please describe yourself for accessibility purposes, and then we'll launch into your presentation. Thank you.
Sure. Thank you for that introduction. As Julie mentioned, my name is Josh Ferno. I'm a pollster. For accessibility purposes, I am a white man with brown hair wearing a black quarter zip with my company's logo on it. That company is called Morning Consult. We are a decision intelligence company that is headquartered in Washington, D.C., that, among other things, provides custom polling research to companies, advocacy groups, and nonprofits and think tanks like the Century Foundation. And today I'm here to talk to you about a poll that we ran about a week and a half ago on the state of childcare in the United States, obviously in the context of the funding cliff that we are talking about today. And I have some slides that I'm going to share with you. Thank you. So if you want to go ahead, that's perfect. This poll that we are talking about today, the state of childcare in the United States, is a poll that we conducted from the 12th of this month to the 15th among 2,200 US adults. And so this data was weighted to approximate a representative sample of the general population of the United States. And among those 2,200 adults, about 600 of them were parents themselves. And so I'm just going to run you through some of the high-level findings from that study we did to give everyone a sense of how folks in the general public are currently seeing and experiencing childcare issues and the kinds of things that we're here to talk about today. And so I won't belabor these points. We'll get into them in more detail, but as Julie laid out, very convincingly in the report, and as people have been speaking about today, the need for childcare is widespread. This is not a red or a blue issue, nor is it unique to any particular socioeconomic class. That need is well documented on a few different fronts. And on my second point there, to the extent that people are currently having their childcare needs met, those who are regularly paying for childcare are not aware of any suitable alternatives to them that they could get in short order if their current childcare provider were to become unavailable for any number of reasons. The expiration of childcare funding at the federal level that we're talking about in September, it does really sort of fly in the face of public opinion on this issue, both in terms of the level of priority people are saying in the responses to this survey that we gathered, that they want the federal government to treat issues related to childcare with, but also the just clear and present situation that we're all in where parents, families are being stretched too thin, suitable alternatives are not available for them, and that is being acutely felt. And then also just, in an election context, championing expansion of childcare options for families, being an advocate for the kinds of policies that we're discussing is popular with voters. It is something that has bipartisan support, and that is to the extent that it moves the needle in a positive direction for political candidates. Next slide, please. We're talking about people's sort of relationship to the childcare system as it exists right now. On the next slide, you will see really three key numbers that are important to take note of here based on the data that we collected here. 39% of US parents that we spoke to, mind you, these are all 18 and up parents, all of adult age. That's 2 in 5 are saying that they currently pay for some sort of childcare arrangement on a weekly basis or more often. And so 2 in 5 parents are paying for something weekly or more often to take care of their children. You can see on the right side some different forms that takes, whether early childcare programs or after school programs for older children. 28% that you see there is among those who do not. So that's 61% of parents who say, no, we do not pay for childcare weekly or more often. That 28% is saying that a quarter of them are saying they would if cost were no object. And so these are people saying, you don't have childcare right now. Is cost the main thing inhibiting you from doing that? And they're saying yes. So all told, what that means between those is that nearly 60%, or 3 in 5 parents in the United States, either do or would have a regular childcare arrangement, money permitting. Next slide. Here we asked people, both just in the general population, and then you see to the right numbers among parents, have you or has someone experienced the following in the last 5 years, just to gauge how is this playing out in people's actual lives, this scarcity of childcare options. And we're seeing on that top bar there, 36% of all adults report they themselves or someone they know have experienced challenges finding high quality, affordable childcare or after school care. And in that 36% of all adults, that includes more than half of the parents that we spoke to, 56% of them. And then down below, you can see that nearly a third, including about half of parents surveyed, have either been late or absent from work for lack of childcare or know someone who has. On the next slide, I think we find really the bombshell finding, so to speak, of this survey, which is this question is asked only of those who do currently have a regular childcare arrangement. So parents who pay weekly or more often for some type of arrangement to take care of their children. if your childcare after school program closed permanently tomorrow, how long do you think it would take to find a suitable alternative, a high quality, affordable alternative? Certainly, there are adults we spoke to who said that alternatives are readily available. 13% believe that they could find one in 1 week or less. But by and large, such an event would cause a real disruption to people's lives, and that there are not alternatives readily available that people find accessible or know how to access. And so 24% of these parents are saying it would take them 1 week to a month to find alternative care. And really, the real takeaway, if you take one thing away from my portion of this, is that more than half of these parents, 54% of them, say that it's going to take them upwards of a month to find alternative care. And in some cases, for 1 in 5, it's going to take them 4 months, 6 months, potentially longer to find an alternative. And now we do see, it's worth noting, a relatively low share of people, I mean, that's an understatement, 1% saying no alternatives exist in my area. But despite thinking that maybe some do, maybe they're not accepting new students, there's no room, they're not accessible from a cost perspective. And people just do not think that in any short order, they're going to be able to remedy that situation if their current childcare provider goes away. Next slide. We transition here into sort of policy stances on these types of issues. And on the next slide, we see that public opinion on this is very clear. We asked people, based on what you know, should the US government be investing more or investing less in childcare programs, such as pre-K, daycare, after-school care, et cetera? A slim majority, but certainly a majority, 51%, are saying that the government should invest more in childcare. That response is even more emphatic among parents, 56% of whom say that. And that just really enormously dwarfs the share of people who are saying less should be spent on these kinds of things. So as we approach this funding cliff in September, that might be favorable for 7% of US adults, but by and large, people are saying that that is the exact opposite of what we would like the federal government to be doing where childcare spending is concerned. Next slide. Concern is high. We asked people about their level of concern about that childcare cliff, the expiration of funding that is scheduled to take place in September. And we see nearly 2/3 of all adults are saying they are very or somewhat concerned about that. And again, even higher responses among parents, nearly 3/4 of them, 71% saying they are concerned. And on the next slide, when it comes to, maybe a more solutions-oriented angle on all of this, candidates for Congress who champion the kinds of stances that we're talking about with regard to advocating for more options, advocating for greater subsidization of the options that do exist, that is a politically popular move, with 70% of all adults saying that they would be more likely to vote for a candidate who does support the expansion of these options, even higher share among parents that we spoke to. And then on the next slide, you can just see those totals as well, broken out by party. And you can see that this is truly a bipartisan issue. It is not red or blue. Certainly enormous support from Democrats on this in terms of being more likely to support a candidate who, supports expanding options, but independents and Republicans agree as well. And so that is everything that we have for this presentation. Next slide is just a conclusion slide, but thank you very much for your time today and for listening, and I'm happy to take any questions.
Josh, thank you so much for that. It's really, heartening to see just how popular this issue is, how pressing it is for families, and just really appreciate your presentation and the data and adding that to round out this conversation. We're going to move into Q&A now. We only have time for a few questions, but certainly we are happy to make ourselves available after this event to answer any additional questions that come up. And so I'm going to turn to Leah Woods to ask a question from the audience.
Sure. Thanks, Julie. So the first question is, and I realize it's a bit of a long one. What can advocates do to prevent going over the childcare cliff in the next 100 days at the local, state, and federal levels? How likely are we to avoid going over the childcare cliff, and what can we do long term?
Thanks, Leah. So, I think that going over the cliff is not inevitable, right? There are things that we can and should do to promote funding and the funding that we need. And so on the congressional level, one thing that's happening right now, congressional leaders are looking to do an emergency supplemental for defense needs sometime this year. And just yesterday, the House Appropriations Committee marked up an annual defense bill that is more than what the president asked for. So if Congress is going to do that and go above these caps that they've put into agreements of the debt ceiling, they should also do domestic emergency needs, and if you think about how much we may be funding for defense spending or to support security assistance in Ukraine, we also need to be thinking about what we're doing back home. And this is a priority to invest in childcare. And so, I think folks can let their members of Congress know that this is urgent and important. We also talked a little bit about how states are taking action. A lot of state legislatures have concluded for the session, but some are still going. And so there's still opportunities to advocate with your states. And I would also just suggest turning to organizations like Moms Rising and like the many, many partners that are co-hosts of this event, like Childcare Aware, and others who have calls to action who you can engage with directly in order to take direct action, and as well as sharing your stories. As you heard, hearing Trina and Diana's stories is incredibly compelling, like what happened to them in real life during the pandemic. And once you hear one story, you can see nobody's alone, right? We are all in this together. And so I think sharing your stories and weighing in with legislators and elected officials, letting them know this is not acceptable. Thanks. You want to do another question?
Thanks so much, Julie. Here's a follow-up for you and another question. How can we properly distribute childcare funding if we do receive it? And what do we do if we don't receive additional funding in the short term?
I know, Trina probably has a lot of perspectives around this. Trina, do you want to answer quickly and then I will share another thought?
You can go ahead and answer.
Okay, great. Thanks, Trina. Yeah, one of the things that we saw during the distribution of the Child Care American Rescue Plan stabilization funds is that when the public was engaged directly, it made a big difference in creating more equitable distribution of these funds. And so having, direct relationships between policymakers and childcare providers, bringing in parents, bringing in unions, bringing in, the community in general really helps to make clear where the distribution should happen and how it should happen. So I think that's really important. I think you mentioned that the other question was what happens if the funding does not come through? Well, we're here talking about this today to keep fighting to make it happen. And so, parents and providers and, families have been making it work since the beginning of time, and we'll continue to do so. But what we can do is have partnerships with government that make it actually work, right? No, don't make it so hard. So thank you for those questions. Again, we are happy to answer questions beyond the event. Please email us, reach out to us directly. I'm going to close us out now. Thank you so much for being with us. A special thank you to everyone who spoke and presented, to our interpreters, our ASL, everyone at the Century Foundation and Watershed Strategies who've helped, Senators Murray and Kane, and all of the partners who helped co-host this event and spread the word about this. We look forward to continuing the work together to make sure that families have the childcare that they need, and we really appreciate that. My last housekeeping note is a recording will be made available immediately on our website, tcf.org. So please feel free to check it out, to share it with your friends who didn't make it today. And once again, thank you, everyone.